Hi, this is Dr. Eric Westman with another edition of Ask Adapt for Adapt Your Life, adaptyourlife.com. Today we're talking about veggies, vegetables, and fruit on a low carb or keto diet. Vegetables are important because they give you fiber, minerals, and vitamins. I'm not so sure fruit is really an essential thing to eat, meaning your body actually needs to consume fruit. There's some debate of whether even the human body needs vegetables if you eat fully nose to tail of animal products, because you'll get all of the essential nutrients that you need from animal products. But why even debate that? You can have vegetables on a low carb diet. At first we would say no fruit on a low carb diet because there's just so much sugar in it. Or if you do have fruit, you have to limit the amount. So why even go there at first? That's why we recommend no fruit at first and a limited amount of non-starchy vegetables at the beginning. The questions Amanda asks, are low-carb veggies good prebiotics, or should I add a little starch to feed my gut bacteria? Well, Amanda, that's a great question, and I don't know the answer. I'm still wondering how the prebiotics, probiotics really matter anyway. There certainly is a lot of hype about them. The clinical trials in humans are very at the early phase. I know a lot of people are pushing them. I take comfort that there have been people doing well without probiotics for a long time. So I still don't know the role. I don't recommend them necessarily. So I wouldn't worry about adding starch or feeding the gut bacteria. The bacteria will be just fine. Judy asks, I keep trying to find out about veggies while taking warfarin and doing this diet. Warfarin is a drug that actually works by interfering with vitamin K. And so you don't want to have a lot of vitamin K, which comes in the green veggies. Judy, just go get a list of foods that have vitamin K and avoid the ones that are in high vitamin K. That's kale, spinach, collards, Swiss chard, parsley, greens, like beet greens, dandelion greens, collard greens, mustard greens. Just get a list and look at the amount. The main thing if you're taking an anticoagulant like warfarin is to check the anticoagulation to make sure it's okay. A lot of people have kits where they can do it at home now. I have lots of patients who are on warfarin and do just fine. Just keep monitoring it. Jean-Marie says, last year was my first spring, summer doing keto. I actually shed a tear in the fruit section when I smelled the ripe plums. If I can control myself to a bite or even a half a piece of fruit once in a while, not every day, will it impede my progress? Well, as always, it comes down to the number of grams of carbohydrates and whether you can control the amount that you eat. So if you can have a bite or a half a piece of fruit and stop there, I would say it's probably okay. Will it impede your progress? Well, probably. So it's all a matter of your comfort level, and there's really no forbidden food on a keto or low carb diet. It's just that if the food has carbohydrates, food or drink, you can't have much of it. So most people can't stop at a bite of an apple or orange or tangerine, something like that. Janie says, I love fruits. What are the best choices and how much? Well, the lowest in carbohydrates. Berries are even lowest. Grapefruit's very low. But at first we would say avoid them because it's hard to control the fruits. Christine asks, wondering about vitamin C. If we say goodbye to citrus, not to worry. There's plenty of vitamin C in the vegetables and other foods that you're eating. You might wonder, how can you get vitamin C without orange juice? That's because of marketing that we've been hearing for so long. How do I get past cravings for fruits, BJ asks. And that's funny. You crave something because you're having it. I mean, in fact, that's a little secret that I know someone's having the food if, a while has passed and they're craving it. I'll often say, ask me if I crave fruit. And someone will then say, do you crave fruit? And I say, no, I don't eat fruit. So I don't crave it. Now it may take a few weeks or a month to not crave the food, but the cravings will go away. or as we mentioned before, you have just a little bit of it. One option to do is to have a little piece of fruit or berries in the yogurt, or some small amount, a little cream on it, so that you just don't have much of it. But at first, just be very careful. Fruit, nuts represent trigger foods, and that means that it triggers your hunger and it's hard to stop having it. Havan asks, I'm going keto again. I'm eating more because I eat plenty of cauliflower and broccoli than the 20 grams of carbs a day. Would it be okay to have 40 total carbs if it comes from these veggies? Would the fiber cancel out the extra carb count? Well, this is a common question, which really is the net carb versus total carb calculation. And does it matter? Well, if it matters or not depends on your metabolism. So if you have the worst kind of metabolism, diabetes, metabolic syndrome, you come to me in my clinic, I'm going to say 20 total carbs as the place to start to make sure that it's working. You might be able to have 30 or 40 and have it work fine. Net carbs is calculated by taking out the fiber and sugar alcohols from the total carbs, assuming that you don't absorb the fiber and assuming that the sugar alcohols don't interfere with the ketone metabolism. I'm not sure that those assumptions always are true, so that's why I'm strict about the 20 total carbs at first. Is net carbs wrong? No, I just think it's a little less effective. It's like an over-the-counter medication. It's not wrong, it's just not as strong as the prescription medicine or a 20 total carb per day type of low-carb diet. Noel again asks, should we subtract out the fiber and from the total? No, I mean, you can, but at first I would say don't. Another point about net carbs is that a lot of products have low net carbs, but they're high total carbs. So I'll teach my patients to look at the back or the side, the nutrition facts, and look at the total grams of carbs, not the net carbs like it says on the front. So always look at the nutrition facts. That will keep you safe. I'm Dr. Eric Westman for Ask Adapt and Adapt Your Life. Please subscribe so you don't miss out. Thank you for watching, and send some comments and questions below, and I hope that's helpful.